if I'm audible. Okay, if I'm not audible, just type it in the chat box. Okay, so a very important lecture in an exam point of view. We'll be covering this lecture under the following headings, that is development of occlusion. There are various phases through which occlusion is being developed. Okay, so we'll be covering it under the following headings, that is pre-dentition period, deciduous dentition, mixed dentition, permanent dentition, and finally a little bit about morphology of deciduous tooth. I think this topic is already being touched upon. The morphology of deciduous teeth is already been taken in the practical lab as well as other lecture, but again it will be kind of a revision for you guys. Okay, so as the topic suggests, no, you should know that the occlusion for a human being, it is actually being established under various stages. Okay, so the first stage in which, okay, before that, a brief intro to your human dentition. Diphodont, we are actually diphodont, we are actually humans, we are diphodont, we have two sets of dentition. As you will be aware, we have the primary teeth as well as the permanent teeth. Okay, so any organism which is having two sets of dentition, they are called as diphodont. There are other organisms who have only one set of teeth throughout their lifetime, like, blue whale, beluga whale, whale species. Okay, they are called as monodont or monophyodont. And whereas there are some species who will have multiple sets of tooth during their lifetime. Okay, one classic example being crocodile. Okay, it is a reptile. And another species of carnivorous fish, which is called sharks. All these will be having multiple sets of tooth during their lifetime. They are called as polyphyodonts. Okay, so remember, monodont, only one set of tooth, example whale species. Diphodont, humans, two sets of dentition. And organisms which are having multiple sets of tooth during their lifetime are called as polyphyodont. Okay, coming to primary dentition. Actually, primary dentition starts from 6 months of age. Okay, average from around 6 months to 7 months when your first tooth will erupt. Usually it is your mandibular primary central incisors, and it will last up to 6 years of age when your first permanent tooth will erupt. Okay, so when the first permanent tooth is erupting, it will start the mixed dentition phase. Okay, so first permanent tooth, all of you know, will be usually your either your first permanent molars most of the time, or sometimes it can be your mandibular permanent central incisors also. Okay, so from 6 years to 12 years you will be having both primary as well as permanent tooth in your oral cavity. Okay, so that phase is called as mixed dentition. Mixed means you will have both primary as well as permanent, and by 12 years of age you will lose all your primary tooth. Okay, so your primary tooth will start shedding by 6 years. Your primary mandibular central incisor will go. Simultaneously, by 12 years you will lose all your 20 primary teeth, and only your permanent tooth will be present. That will mark the beginning of your permanent dentition. Okay, now coming to the first phase, pre-dentate period. As soon as the child is born, there are no tooth. Okay, usually there are no tooth present. There can be exceptions of natal and neonatal teeth, which is natal teeth means tooth which is present at birth, or neonatal teeth are teeth which are erupting within the first 3 weeks after birth. Okay, there are exceptions. That is a topic of discussion for another time. Usually, as soon as the child is born, there will be no teeth present. Okay, there will be only something called as gum pads which are present in the oral cavity. Okay, so this period of birth, from birth to eruption of first deciduous teeth in the oral cavity, that is till 6 months. Okay, from birth to 6 months, it is called as pre-dentate period. Normally at birth there are no teeth present. Okay, this period lasts for 6 months, and alveolar process which are present at the birth are called as gum pads. Okay, what you are seeing in the picture, no, these are gum pads. Okay, only gums are present. Okay, or gum pads. Okay, so you should know that, as the picture suggests, no, they are pink. Okay, they are horseshoe shaped, and they are covered by a dense layer of periosteum. Okay, these are the features of the gum pad. But there are certain landmarks which you have to keep in mind when we are discussing about gum pads. Very important, especially exam point of view. You can look at the diagram. Okay, so gum pad is divided into, each gum pad, that is your maxillary as well as your mandibular, is divided into 10 segments. Okay, and they are called as transverse grooves. Okay, each of these segments consist of one developing deciduous tooth sac. Okay, so As you know, there are 20 primary teeth, right? So we'll be having 10 segments each. Okay, in your maxillary arch, to accommodate the 10 primary tooth which is present in your maxillary arch, there will be 10 transverse groove, and simultaneously you will, in the mandibular arch also, you will be having what, 10 transverse groove to accommodate 10 primary tooth in your mandibular arch. Okay, and one important landmark is called as the lateral sulcus, which is the transverse groove which is present between your deciduous canine and your first deciduous molar. Okay, very important. They are called as lateral sulcus. Transverse groove. Lateral sulcus is also a transverse groove, but it is usually present between the first primary molar and your primary canine. Okay, and it actually helps to predict the interarch relationship at an early age. Based on the relationship of the lateral sulcus, we can predict what kind of skeletal molar relationship the child can have in future. Okay, all what kind of molar relationship the child can have in future. That is a significance. Then you can see one another landmark called as dental groove. Okay, dental groove usually divides the arch into a labiobuccal portion and a lingual portion. Okay, just to differentiate between your labiobuccal portion and the lingual portion, we have another landmark called as dental groove, and we have something called as gingival groove, which will again differentiate between your what, the palate as well as your the lingual groove. Okay, so these are the landmarks which you have to actually keep in mind. So with regard to predentate period, do you guys have any doubts? Do you want me to repeat any particular point, or is it clear? Everything is clear? Please respond. Okay, guys, we don't have time. It's slightly big lecture. If you want me to repeat anything or you don't want me to repeat, please type it in the chat box. Okay. Okay. Now coming to deciduous dentition, as I told you, by 6 months of age, your first tooth will erupt, your primary tooth will erupt, and it will mark the beginning of your deciduous dentition. And we have 20 primary tooth. We don't have the premolars in your primary dentition. Okay, we have only your central incisors, laterals, canines, and your first and second primary molar. We don't have third molar also. Okay, so there will be 20 tooth in total, 5 in each quadrant. Okay, so again, your primary dentition will have certain characteristic feature. Spacing is essential. Okay, spacing is present. So at this point of time, can anybody tell me if in adults, when we see spacing, most of us we go for ortho treatment, right? So is spacing a good thing or a bad thing in children? What do you guys think? Is it a good thing or a bad thing in children, spacing? Good. Okay. Yes, you're correct, Hind. It is a good thing because simple logic. There are other factors to it also, but commonly what we will think when we use our common sense, we want to accommodate the permanent tooth, right? And we all of us know that permanent tooth are bigger when you compare with your primary tooth. So you want to accommodate a big tooth in the arch in a later stage. So we want that extra space. So spacing is always good. Okay. So if you see a well aligned arch in a primary dentition, or a child having a properly aligned arch of teeth without any spacing, that means there is a high chance, almost 90% chances are there that the child can have a crowding at a later stage or some kind of orthodontic issues at a later stage. Okay, so a well aligned arch without any spacing in a primary dentition is not a good sign usually. Okay, so this spacing again, no, we have various spaces which are seen throughout the arches. We have two spacing which you have to keep in mind. Okay, one is the primate space, and another one is the generalized physiological spacing. And you should not think that okay, spacing, so it will have one function. Okay, so your primate space will help us in one function, whereas your generalized physiological spacing will help us in another function. So that I will discuss in due time during the course of this lecture. But just keep in mind what is the difference. Okay, so primate space are spaces which are seen mesial to your maxillary canine. Okay, and distal to your mandibular deciduous canine. Okay, always keep this in mind. So if you look at this picture, in the top picture you can see mesial to the maxillary canine is primate space are seen in the maxillary arch, and distal to the mandibular canine, it is seen in the mandibular arch. Okay, so this is the difference, and these only these spaces are called as primate space. Okay, all the other spaces are called as generalized physiological spacing. Okay, so this you have to keep in mind. And primate spaces are known by other names like anthropoid spaces. I'll just type it in the chat box for your reference. Anthropoid spaces as well as simian spaces. Okay, these are the other names. Okay, I think it is there in the what do you say, in the PDF. Okay, you can, so other names for primate space are anthropoid spaces or simian spaces. Okay, so keep this in mind. It is present mesial to your maxillary deciduous canine and distal to your mandibular deciduous canine. And coming to all the other spaces are called as generalized physiological spacing, and these two spaces have two different functions. Okay, I'll discuss that when the time comes. Just keep this in mind for the time being. Now coming to the what do you say, the average length in mm. Okay, so these are present between the primary tooth, as I told you, the physiological spaces. In your maxillary arch you will have around 8 mm. Okay, so that is around 4 mm in one quadrant, and in your mandibular arch you will have around 3 to 3.5 mm, in total around 1 to 7 mm. Okay, that is the range of the spacing. Okay, so this will help us in various functions. Okay, this please, for exam point of view, you should know this, you should by heart it actually. Okay, this 0 to 8 mm or one cotton, how much it is and all, you should have to mark it up. Okay, and there is no other way. Now coming to terminal plane relationship. Okay, very important again. Usually, as I told you, in your primary dentition period, we don't have your first permanent molar, and at least some of you might be knowing that we depend on the angles molar classification when we look for the molar relationship, right? So when molar is not present, what do we depend on? We depend on the terminal plane relationship in primary dentition. So in a tooth where there are only primary, in an individual where there are only primary tooth, we depend on terminal plane relationship. So what are terminal planes? It is a mesiodistal relationship between the distal surface of maxillary and mandibular primary second molar. Okay, and usually the landmark which we actually keep in mind is the distal surface of mandibular second primary molar. Okay, very important, always keep this in mind. It is usually said on the basis of distal surface of mandibular second primary molar. It is not a cusp to fossa relationship. Okay, it is based on the distal surface of mandibular second primary molar. And please don't bring cusp and fossa when we discuss about terminal planes. Okay, so we have three classification again. We have the flush terminal plane relationship, a mesial step as well as distal step. So guys, just keep attention right now, because very important. If you actually concentrate now, it will be easier for you guys to understand. Okay, because lazim, this is going to be asked when you come to your level 9 and all. We have case history in this will be definitely discussed. It will be very useful for you in your future. Okay, if you concentrate now. So coming to flush terminal plane, what flush terminal plane is? Okay, so the distal surface of upper and lower molars in a straight plane, and therefore situated in the same vertical plane. So you, when you look at this diagram, okay, just imagine this is the this is a second picture. You are seeing a straight line, right? So you are seeing the distal surface of mandibular second primary molar and distal surface of maxillary second primary molar is in a straight line. This is called as flush terminal plane relationship. Okay, and keep this in mind. This is the most favorable relationship for the eruption of first permanent molars into a normal class 1 relationship at a future stage. Okay, so flush will give you 90% of the time. Flush terminal plane relationship in a child will lead to class 1. Okay, so keep this in mind. Flush will lead to class 1 in 90% of the cases. Okay, so there is a 10% probability that it won't lead to class 1. That we will discuss at a later stage. Okay, but right now just keep this in mind. Flush means the distal surface of mandibular second primary molar and distal surface of maxillary second primary molar is in a straight line. Okay, same vertical plane. Okay, and flush will give rise to class 1 majority of the times. Okay, now coming to mesial step. Here, as I told you, it is always based on the distal surface of mandibular second primary molar. We tell terminal plane relationship. So here distal surface of mandibular second primary molar is mesial to that of upper. Okay, so it is actually mesial to that of upper second primary molar. Distal surface of upper second primary molar. When you look at the picture, no, you can understand that here the distal surface of mandibular second primary molar is mesial to that of upper second primary molar. That is called as mesial step. And mesial step is usually erupting into a class 1 molar relationship again. Okay, but there are chances that mesial step can become class 3. Okay, there is a probability that mesial step can give rise to class 3 molar relationship. flush can give rise to class 1. Mesial step is already erupting into class 1 molar relationship. Okay, but in future, due to various changes, it can become class 3. Those changes we will be discussing again. Don't worry, just keep this in mind for the time being. Distal step. So now you will be knowing what distal step is, right? So distal surface of mandibular second primary molar is distal to distal surface of maxillary second primary molar. Simple. And here it is an unfavorable relationship, and it guides the permanent molar into a distal occlusion. That is class 2 profile will be there in future. Okay, when the permanent molars are erupting. So just again to revise, flush will give a high chance, it will lead to flush terminal plane will lead to what? A class 1 molar relationship in future. Mesial step is already erupting into class 1 molar relationship. There is a probability that mesial step can become class 3, and distal step is erupting in a distal occlusion, and it will lead to a class 2 molar relationship in future. Okay, so these are what you have to keep in mind. So now I told about the probability. If you remember, there it is not always the same. Okay, there are probability, and this probability depends on what? It depends on the physiological, sorry, the primate spacing, which is, as I told you, know, the primate spacing which is there. What is primate space? Come on, tell me fast. What is primate space? I already told you what is primate space. Where is it seen in maxillary and where is it seen in mandibular arch? Are you guys there? Guys, what is primate space? No one. Okay. So I told you, right? Yeah. Yeah. Very good. It is seen between mesial to the maxillary canine and distal to the mandibular canine, primate space. Okay. So this probability of flush being, yeah. Okay. Okay. Yeah. This probability of flush being class 1, mesial being class 3, and distal being class 2 depends on various factors. If you look at the arrows, no, there is shift of tooth. Shift of tooth means, of shift of teeth means, it is actually utilizing the primate spaces. Okay, then there is, if we all know, there as the child is growing, no, there is forward and downward growth of the mandible. If that growth is minimal, then it will lead to something, and if it is normal, then it will lead to something. Okay, so in case of distal step, we'll discuss what is distal step. Distal step, the distal surface of mandibular second primary molar is distal to that of maxillary second primary molar. So if at all it is undergoing a normal forward growth of mandible, then distal step will become end to end relationship. Okay, class 2 end to end. If at all there is a utilization of shift of teeth in distal step, it will lead to class 2. Okay, and if there is minimal growth differential, it will be somewhere in between class 2 and end on relationship. Okay, that is what you have to keep in mind. Flush terminal plane, where the distal surface of both the molars are in the same vertical plane. If the forward growth of mandible is happening normally, flush will become class 1. If there is a utilization of what do you say, the primate spaces along with the forward growth of mandible, it will become end on relationship. Or if there is minimal growth differential, it will be somewhere between end to end and class 1. Okay, flush terminal plane. Similarly, mesial step, when the lower second primary molar is mesial to that of upper, you will get, when there is a forward growth of mandible, mesial step, as I told you, it is erupting into class 1. But if there is advanced forward growth of mandible, then it will become class 3. If there is shift of teeth, it will become minimal shift of teeth or minimal growth differential, it will be somewhere between class 1 and class 3. Okay, so this is what you have to keep in mind. So to make it more simple, you should know that there is utilization of physiological spacing, as well as there is sorry, not physiological spacing, utilization of primate spacing, as well as there is forward and downward growth of mandible. Okay, so majority of the time distal step will be actually giving you a end to end relationship or a class 2. Flush will be giving you a class 1. Okay, and flush can become end to end also. Okay, that you have to keep in mind. Mesial step is already erupting into class 1, but there is a probability that it can become class 3. Okay, so distal class 2, flush class 1, mesial step can become class 3. Is it clear, guys? It's a little bit confusing, but if you want me to explain once more, I can. Okay, is it clear? All clear? Please reply fast. Okay, yeah. Okay. Now coming to mixed dentition. When the first permanent molar is erupting at 6 years, it will start the beginning of this phase. Again, mixed dentition phase can be divided into three periods. Okay. First transitional period marked by two important events, that is eruption of your first permanent molar and there is exchange of primary incisors with your permanent incisors. Then there is an intertransition period which is a stationary period where there is no much changes happening, and finally second transitional period where your premolar syrup, that is eruption of bicuspids, the canines are exchanged, primary is exchanged by your permanent canines, and there is eruption of your second molar. Okay, these are the important events in your mixed dentition period. So coming to first transitional stage, as I told you, two important events. Okay, emergence of first permanent molar, okay, that is one important event, and there is exchange of deciduous incisors with your permanent incisors. So this will actually mark the establishment of your occlusion. So first transitional period, as I told you, when the first permanent molar erupts, okay, this is what you have to keep in mind. So when the first permanent molar erupts, it will actually cause early mesial shift. If you look at the previous, when we were discussing regarding the terminal plane relationship, right? When you look at the picture, you can see the first permanent molar is erupting mesially. It is going and exerting force where it is going exerting force on the distal surface of mandibular second primary molar, right? Distal surface. So this will in turn exert force on the first primary molar. And we can see, where do we find primate space in the mandibular arch? We will find distal to the canine, right? So this space is getting closed. And as a result, class 1 molar relationship is established. Okay. This is what you have to keep in mind. So during the eruption of first permanent molar, the primate space is closed and the primate space is utilized to gain what? To gain class 1 molar relationship. So the use of primate spaces, I told you, primate space has a different function. Physiological spacing, that is the generalized spacing. Other than the primate space, all the other spaces are called as physiological spacing. Physiological spacing have another function which we will be discussing in coming slides. But keep in mind, primate space during the early mesial shift period, that is when the first permanent molar is erupting, it will give rise to class 1 molar relationship. Very important point. Definitely this is going to come for the exam. Okay, so primate space is utilized during the early mesial shift to help it to get what? Class 1 molar relationship. Okay, now if at all in certain individuals, no, if there is no spacing, okay, as I told you, there can be space dentition as well as non-space dentition. Okay, so some children there will be no spacing, so there is they cannot utilize the primate spacing, so still they can achieve class 1. How? When the mesial migration of first permanent molar after the loss of second deciduous molar is happening by utilizing something called as leeway space. Okay, leeway space, we have not discussed it yet, but just keep this point in mind. There is a slide coming on leeway space. Okay, so if at all there is no primate space for an individual, still the individual can get class 1 molar relationship in late mesial shift. What is late mesial shift? When the first permanent molar is actually coming into class 1 molar relationship after the loss of second deciduous molar in your late mesial shift period. Okay, so late mesial shift period is somewhere between your 11 to 9 to 11 years of age. Late mesial shift is happening, and at that time, there is something called as leeway space. I have not discussed regarding leeway space. I will discuss it in due course, don't worry. But keep this in mind: late mesial shift, leeway space; early mesial shift, primate space. Okay, so early mesial shift, primate space is actually utilized to get class 1. Late mesial shift, leeway space is utilized to get class 1 molar relationship. Okay, now as I told you, exchange eruption of molars is one important event. The next important event is actually called as exchange of incisors. Okay, so there is something called as incisor liability. If you look at the picture, the primary incisors are smaller when compared to that of permanent incisors, right? So it is said that the excess which is required to actually to allow the permanent incisor to erupt into the arches in the maxillary arch, we require 7 mm extra to accommodate the maxillary permanent central incisors. Similarly, in the mandibular arch, we want 5 mm extra to actually accommodate the mandibular permanent central incisor. Okay, so where will this space come from? So here we utilize what is called as physiological spacing, not the primate spacing. All the other space, the space seen between your primary incisors and all the other spaces are called as the physiological spacing. Primate space are only seen mesial to the maxillary canine and distal to the mandibular canine. All the other space are called as physiological spacing. And for accommodating the incisor, we utilize the physiological spacing. Okay, is it clear, guys? Is it clear? I know it is a little difficult to understand, but if you listen properly, you'll get this. Okay. So physiological spacing is one of the ways in which we actually utilize the incisor to accommodate the incisors. Physiological spacing is utilized. Not only this, okay, we won't get 7 mm with just this physiological spacing. So we will depend on something called as increase in intercanine arch length and width also. Okay, as a child is growing, there is an increase in the intercanine arch width and length. That will also help to accommodate the permanent incisors. That is a second point. Okay, so one is utilization of the physiological spacing. Second point is utilization of the increase in intercanine arch width and length when the child is growing. Okay, and finally there is something called as incisor interincisal angulation. Okay, it is called as incisor labiality. If you look at the child, there will be not much of overjet. Okay, it will be like the both the tooth will be in almost same line. Okay, even though the maxillary incisor will be slightly overlapping the mandibular incisors, but it will be in a very straight angle. Okay, so the angle is said to be somewhere between 150 degree. Okay, in primary. Okay, it is said to be somewhere around 150 degree, the interincisal angulation. Okay, but when the permanent incisors are erupting, they erupt at an angle of 123 degree. Okay, I have typed it in the chat box. So 123 means there is more of proclination. So this proclination will also allow the incisor to accommodate in the arch. Okay. So these are the three things which will help the incisor alignment or incisor liabilities corrected by three things. One is your utilization of your physiological spacing. Second, increase in intercanine arch width and length. And third, the angle. Okay, the angle when the primary, it will interincisal angle is 150 degree, whereas in your permanent it will be 123 degree. So this proclination will help to accommodate what the incisor. So these are the three things by which the incisor liability is corrected. Okay, and again the measurement, keep in mind, maxillary arch we want 7 mm extra, and mandibular arch the incisor liability is 5 mm. Okay, now coming to the second transitional stage. Okay, so remember the second transitional stage, the emergence of bicuspid, cuspids and second molars are happening. Okay, so one key point I would like to revise again. If at all in the early mesial shift, if class 1 molar relationship is not established, this is where the class 1 molar relationship will be established. Okay, in the second transitional stage, remember this slide, which I told you. In this slide you will see closure of primate space, early mesial shift. In early mesial shift, if the child is not having any space, in this late mesial shift is in the second transitional stage. Okay, don't confuse it. Okay, so it is in the second transitional stage where the class 1 molar relationship will be established. How I will discuss now. Okay, so this period, the important event is emergence of your premolars, your permanent canines and the second molars, and it will establish the occlusion. So, see, as I told you, the early mesial shift, primate space are utilized. Okay, but here it is called as leeway space of Nance. Leeway space is actually utilized to establish what the class 1 molar relationship. So, what is leeway space? So, if you look at the picture, the value I will tell. Okay, in maxilla, the leeway space of Nance is 1 mm in maxillary arch. That is 0.9 mm on each quadrant, and mandibular it is 3.4 mm. Okay, so 1.7 mm in each quadrant. So what is this leeway space? If you look at this picture now, you will understand that the combined mesiodistal dimension of your primary canine and your primary molars are more than that of your permanent canines and your premolars. Okay, if you look at the picture now, you are seeing, look at the mandible, you will understand much better. The combined mesiodistal dimension of your primary canine and your primary molars are more than that of what your permanent canine and permanent premolars. Okay, so that extra which you are getting in your primary dentition, that is called as leeway. So in your mandibular, you will get, due to this excess mesodistal dimension, you will get 3.4 mm extra, and maxilla you will get around 1 mm extra. So this extra is actually utilized by the molars to come into class 1 molar relationship, if at all that individual does not have what? That individual does not have primate spacing. Is it clear, guys? Is it clear? Very important concept. If you look at the picture again, I'm explaining, okay, because I know some people won't get this. The mesodistal dimension of your primary canine and your primary molars, okay, is bigger or more than that of your mesodistal dimension of your permanent canine and premolars, okay. So that extra, when this, so when this tooth is shedding off and when these premolars are erupting, there is this extra space. You look at the blue marking, okay, blue marking, that is extra space. That space will be utilized where? By the molars to come into class 1 molar relationship in your late mesial shift. That is when this primary tooth is replaced by your permanents, successors. Got it? Is it clear? Please respond. Please respond. Is it clear? Okay. See, it will be much more clear if it was in a classroom. Okay, so if we, I could have drawn and shown you, but it's okay. If you don't understand, you can ask me anytime. Okay, yeah. So now coming to next phenomenon, which is called as the ugly duckling stage or broadband phenomenon. Again, very important. See, this lecture is full of important points, okay, because there are various fancy names like these things: broadband phenomenon, Levi space of Nance, primate space, physiological spacing. So, very important lecture with in your from your exam point of view. Okay, so please, all these things don't confuse. Different names are there. Okay, lot of facts are actually there in this lecture. That's why it can become confusing, so just concentrate. So ugly duckling stage, this stage is usually seen from it is there in the PDF. I'll just type it in the chat box. 9 to 11 years, okay. Usually you see the stage ugly duckling in the 9 to 11 years of stage. You will see a midline. Why it is called as ugly duckling? Because you will see a midline diastema between your incisors, okay. So midline diastema seen in maxillary arch during the eruption of permanent canine, that is called as broadband phenomenon. It is a self-correcting anomaly and space closes with eruption of your permanent canine. So usually you will get parents bringing their child with a big midline diastema. They are concerned about the look of the child, okay, and they will come to you telling that, doctor, I want orthodontic treatment to correct the spacing. So that time you should know that this is a self-correcting phenomenon. You should not start with your ortho treatment or refer them to an orthodontist, okay. You should reassure them that when the canine is erupting, this space will become closed, okay, and no need of doing anything, okay. It is a self-correcting phenomenon, okay. It's a transient malocclusion, okay. That's what you have to tell them. So how it will get corrected? You know, by 11 to 12 years of age only, your maxillary, 12 to 13 years of age only, now on an average the maxillary canine is erupting. So if you look at the picture, it is self-explanatory. When the maxillary permanent canine is erupting, no, it will exert force where? It will exert force on the roots of your lateral incisors, correct. Lateral incisor would have been already erupted, because by 8.5 9 years of age, lateral incisor would have been already erupted, okay, and central incisors by 7.5 years of age would have been erupted in permanent. I'm talking about permanent, okay. It would have been already there in the arch, okay. So the maxillary canine will exert force where? On the roots of your lateral incisor, and it will actually move the roots more mesially, okay. Roots, not the crown, the roots. So this will go and exert force where? This lateral incisor will go and exert force on the roots of your central incisor. So the central incisor will actually displaced laterally, okay. The roots are actually moving mesially and the central incisor are becoming widened. But subsequently, when the canine is erupting, no, the force will actually be it will be exerted on the crown, and the crown will push the crown of the lateral incisor will push the crown of the central incisor to the midline, okay, and as a result the diastema will get closed, okay. Understood? I think it is self-explanatory, right? I think if you look at the picture, you can understand it. Okay, is it clear? So when the canine is completely erupting, all the spaces are closed. Okay, hope it is clear. Okay, and yeah, see, yeah, this is even better. Okay, this picture. Look at this picture. The lateral, the canine is erupting. It is actually exerting force on the roots, which will again displace the crowns and causing midline diastema. And when once it is coming more down, it will again exert force on the crowns, and the midline is closed. So that is regarding the mixed dentition. So as I told you, important phenomenon here is the establishment of the occlusion after the eruption of your second molars as well as your cuspids and canines. Again, keep a note of your leeway space of nance as well as your eruption of your first permanent molar in your early mesial shift. All these things are important points which you'll have to focus with regard to exam. So once all the permanent tooths are erupting and all the primary tooth are gone or shedded off, okay, then we get what is called as the permanent dentition from somewhere around 12 to 13 years of age. Okay, so usually at around 12 years of age they say. So at this particular age, 12 to 13 years of age group, you will find only permanent dentition in the arch, and this will mark the beginning of your permanent dentition period. Okay, so you will have how many teeth? All of you know, we'll have extra, we'll get along with your premolars, we have here the first permanent molar, second permanent molar by 12 to 13 years of age would have been erupted. Okay, and by 17 to 21 of years of age, you will have what, the eruption of your third molars. Okay, so don't confuse. By 12 years of age you will have only 28 teeth. Okay, 12 years you will have 28 teeth. Only by 17 to 21 years of age you will have your third molars. Okay, that time you'll have 32 teeth. Okay, so permanent dentition, we have 32 teeth. And here the molar relationship is based on what, the angles class 1, class 2, class 3. I am sure more, all of you know what angles class 1, class 2, class 3 is, right? So it is, this is a cusp to fossa relationship. Basically we say mesiobuccal cusp for class 1. What do we say? Mesiobuccal cusp will coincide with your buccal groove, right? In class 2, your mesiobuccal symbol, how I remember this is your mesiobuccal cusp will actually be anterior to your buccal groove. That's how I remember. Okay, and same goes for your division 1, class 2 division 1. There'll be proclination, labially inclined, what, labially inclined, no, not labially inclined, proclined anterior teeth. That will be your, along with your class 2 you will have what do you say, a proclination of your maxillary incisors. And class 2 there will be labially inclined maxillary incisors. Division 2, okay, I'm talking about division 1 and division 2. And class 3, what it will be, it will be the mesiobuccal cusp will be anterior or posterior to the buccal groove. See, class 1, your mesobuccal cusp will coincide with the buccal groove. Class 2, it is anterior to the buccal groove, right? So class 3 will be anterior or posterior. Look at the picture and tell me fast. Class 3, your mesobuccal cusp will be anterior, yeah, posterior. Okay, so and like once all the tooth is erupted, you will establish your occlusion. Now this is a very interesting slide again. So during this establishment of occlusion, no, during this various phases, pre-dentate period, primary dentition period, mixed dentition period and all, you will get various self-correcting anomalies. So one of the self-correcting anomalies which I already told is what, it is your ugly duckling stage or broadband phenomenon. That is a self-correcting anomaly. Similarly, during your pre-dentate period, when there is no tooth in the arch, right? Do you remember gum pads, right? Your mandible will be retrognathic. Okay, it will be like a class 2 mandible, retrognathic mandible. That is usually corrected by differential and forward movement of your mandible. Okay, so retrognathic mandible pre-dentate period, it is a self-correcting anomaly that is corrected by the differential and forward movement of your mandible. Okay, that is a self-correcting anomaly again. And you, during that period, you can find certain phenomena like anterior open bite can be there, infantile swallowing can be there. Again, this is corrected when, by the eruption of your primary incisors at around 6 to 8 months. Okay, that will get corrected. Coming to your primary dentition, again there are various features like your deep bite can be present. Okay, deep bite is present and decreased overjet is present. This is corrected by the eruption of deciduous molars. Then again there can be attrition of the incisal edges. Similarly, your self-correcting anomalies seen during this phase is your flush terminal plane relationship. Remember, distal surface of mandibular primary molar and your maxillary primary molar is in the same vertical plane. Okay, second primary molar I'm talking about. So this is corrected when, this is corrected when your permanent molars erupt. Okay, in the early mesial shift in your primary dentition. Okay, then coming to mixed dentition, again you will find certain self-correcting anomalies like anterior deep bite can be there in your mixed dentition period. Okay, this will get corrected when the all the permanent posterior teeth are erupted. Okay, and finally what, the eruption of permanent maxillary canine will correct what, the broadband phenomenon or ugly duckling stage. So these are the various self-correcting anomalies you will be seeing in different phases. It is again given in your PDF properly. Okay, it is not mentioned what are the different types of anomalies. Okay, I just told to you guys. Okay, and anyway, this lecture will be recorded, so you can hear the lecture again. Okay, so these are the self-correcting anomalies. No need to do any particular treatment for such anomalies. So that was with regard to your uh, uh, development of occlusion. Hope you guys understood something out of this. Okay, anything which you guys want me to repeat fast? We are in the last phase, that is the difference between primary and permanent teeth. Do you want me to repeat any particular slide or any particular dentition period? Okay, because I know there is a lot of facts. Okay, okay, everything is clear. Okay, fine, good. So coming to the last part of the lecture, which is your difference between primary and permanent tooth, I think this is already taken in your practicals once, but you should be knowing. I'll just revise it once more fast. So as you know, the number, in primary we have 20 primary tooth, and in your permanent we have 32. Which are the tooth which is extra? Or I already told you. Crown inclination. Yeah, this is the same point with regard to your incisal liability. Okay, so if you look at the picture, no, your primary tooth is more vertically oriented. Okay, this angle is somewhere between 150 degree, whereas your crown is labially inclined in your permanent. This angle, it is more at an angle, right? This is 123 degree. So this will actually help you align the permanent central incisor, which is actually erupting. Okay, good. This picture is there. Yeah. Now coming to the morphology in your primary, primary tooth is, the crown will be smaller in size compared to a permanent, which will be larger. The crown, again, the mesodistal dimension will be greater than the incisor cervical. Coming to the shape I'm talking about, so the mesodistal dimension of primary tooth will be greater than the incisor cervical, whereas it will be somewhat equal. Okay, mesodistal will be equal to that of incisor cervical, especially in your permanent molars and all. The mesodistal dimension will be equal to that of your incisor cervical. Okay, now crowns of anterior teeth, again the primary tooth mesodistal dimension is more than that of your incisor cervical, whereas in your permanent, incisor cervical is more than that of your mesodistal dimension. Okay, now coming to cusp and fossa, you get very shallow cusp, for cusp and fossa, which is not very steep. Okay, so it is the occlusion anatomy. You will find this shallow fossa cusp. As a result, no, there is, which is a good thing. There is lesser chance of food lodgement. Whereas in your permanent, no, you will find deeper fossa, steep cusp and all. As a result, no, you will get very prominent pits and fissures. Okay, and this pits and fissures can lodge what? They can lodge food debris. Okay, and this can lead to caries formation in future if not properly brushed. As a result, when there is deeper fossa and steep cusp, no, we will actually we get prominent pits and fissures. That's why we put a preventive measure called as pit and fissure sealant. Okay, and we make this deeper fossa into shallow fossa. Okay, that's the ideology of what? The pit and fissure sealant. Okay, now coming to again the crown morphology on your molars. No, you will get cervical ridge on the buccal surface of molars, which is very prominent in your primary. Okay, you will get a very prominent cervical bulge. Okay, actually this is a characteristic feature of your primary dentition, especially your primary molars, and this cervical bulge will help in the retention of your stainless steel crown more often than not. Whereas in your permanent tooth, you won't get this cervical prominent cervical bulge. It is less prominent, and you will find the cervix of the crown is more constricted. Okay, the CEJ and all is more constricted in that region in the primary. Okay, whereas there is lesser constriction in your permanent. Now coming to the root morphology, if you look at, there is no identifiable root trunk. Root trunk means from the CEJ to the furcation. That region is called as root trunk. Okay, if you look at the dimension from the CEJ to the furcation, it is less, right? So there is no identifiable root trunk present. As a result, no, you will get lot of furcal lesions in primary. Okay, so it is whenever there is an abscess and all, it is called as furcal abscess because of this reason, because there is not much of root trunk. Whereas in your permanent, if you see from the CEJ to the root trunk, there is sufficient thickness. Okay, so there is a very significant root trunk which is present in your permanent tooth, and as a result, yeah, that is one thing. And coming to flaring of roots, it is more. Why flaring of roots? Because the primary root want to accommodate the permanent tooth buds, right? So usually the permanent tooth buds will be in between the roots of your primary tooth. Okay, so as a result, to accommodate the permanent tooth germs, the primary roots have flaring. Okay, whereas in your permanent, it is less. Okay, And shape, again, the roots are more slender, whereas in your permanent it is more thicker. Now, coming to the pulp canal and root canal morphology, the mesial pulp horn is relatively large and it is highly placed. Okay, so especially when you're doing an MOD preparation or a class 2 in a mesial aspect, you'll have to be very careful because the mesial pulp horn is large and it is highly placed, whereas it is relatively small in your permanent. Coming to the shape of the root canals, the shape of the root canal is flat and ribbon shaped in your primary, whereas it is oval or tube like in your permanent. Okay, and axillary canals, you get a lot of axillary canals in your bifurcation area. Okay, that's why it is called as a Furcal abscess at times, whereas in your permanent you will find a lot of axillary canals in your lateral walls. Okay, so this is what you have to keep in mind with regard to the morphology of your primary and permanent tooth. That brings us to the end of this lecture. Hope you understood all the important points. If at all there is any doubts, you can just type it in the chat box. I'll wait. Any doubts, guys? Okay, if there are no doubts, you guys can leave. Okay.